start the session. Hi, everybody. This is University's Bern Klug with the School of Social Work at the University of Iowa, and I'd like to welcome you to this webinar this afternoon. This is a webinar that's part of the National Nursing Home Social Work Network, and our financial support comes in part from the Retirement Research Foundation. I want to start us off by talking a little bit about what's coming up today. Handouts for today's session are on the website if you would like to follow along, or please also know that they'll be on the website in days with the recording of today's session if you need to leave early and you want to hear what happened. For those of you who are joining us during this live webinar, and if you registered, we have your email information. We have the time that you clicked on and clicked off, and we'll prepare a certificate of attendance for you and just automatically email it to you. So if you're on the webinar for 45 minutes, your certificate of attendance will say your name and the name of the webinar in 45 minutes, and there's cost for that. Please use the Q&A box if you have any questions for the presenters. You can submit your question at any time, although we'll save time at the end of our session today to address those questions, unless it's a clarifying question. If you have a question about logistics, like you can't hear very well or there's something wrong that you want to know about being part of the webinar better, put that in the chat box and I'll help you with that. To the best of my ability. Our webinar expectations are to last about 1 hour today. We have 3 speakers, and I'll be introducing them momentarily. The first 2 will share about 15 minutes, and then our last speaker will speak for about a half an hour, and then we'll entertain questions from the group. So we're really looking forward to that. So right now I'd like to move ahead and introduce our first 2 speakers, be Cathy Tompkins and Bob Connolly. Today's overall topic, is supervising social work field students in nursing homes. Our first 2 speakers are going to talk a little bit about the general climate and some big picture ideas, and then our third speaker, Lynda, will talk about the experiences that she's had at Hood College. So our first speaker will be Cathy Tompkins. Dr. Tompkins joined the faculty at George Mason University back in 2003. She's an associate professor in the Department of Social Work, and she coordinates the gerontology program there at George Mason, and she's also the assistant dean for undergraduate studies at College of Health and Human Services, and it includes, I think, 5 or 6 disciplines. So it's a big job. Dr. Tompkins' research areas include family caregiving, for dementia care, and then also kinship care. Before she joined George Mason University, she was the coordinator for the John A. Hartford Faculty Development Project at CSW-E, and also the director for AGI, the Association for Gerontology in Higher Education. And she's a John A. Hartford Faculty Scholar in Geriatrics Social Work. After she speaks, then we'll hear from Bob Connolly. Bob Connolly's the co-host for this entire webinar series, and he'll actually be one of our speakers today. He's been consultant with CMS from 2008 to present after retiring in 2008. Sorry about that. He was at CMS for almost 20 years, and one of his last assignments was working on the MDS version 3.0 and getting that ready to go. He has worked as part of the National Nursing Home Webinar Presentation Series these last couple of years very closely with me, and he also is working with Maryland in their educational efforts to outreach to undergraduate students and getting them interested in working in aging. Has 14 years experience as a clinical social worker and administrator at Children's Hospital in California and also at Hopkins in Baltimore. He earned his BA in Social Services at San Francisco State University and his MSW at the University of Connecticut. So I'm going to turn this over to Cathy now to take over. Thanks, Cathy.
Good afternoon, everybody. So I'm going to begin and just give you a brief overview of why we need BSWs in nursing homes, as well as talk to you just briefly about the Harvard Initiative and how that has helped get content and placements in nursing homes for social work education. So many social work students are not aware of the broad range of settings and practice opportunities in gerontology, so they may often reject an opportunity to work with older adults and their families due to misperceptions, so all the myths that are out there about working with older adults. So one way we can help with that as educators is really to increase the experiential learning activities while they're in the classroom. So meaning, while they're in a classroom, to also have them go out to a senior center or a nursing home and assisted living and do some kind of volunteer work or some kind of interaction with older adults and their families. When students are exposed to the variety of people within the aging population and educated about the many venues in which social workers can practice, they're more likely to choose an aging focus or concentration. So this can lead to a professionally challenging and gratifying career in gerontology. So it's really important from my perspective to give students exposure to older adults across this continuum of healthy aging all the way down to the skilled care need. So not just, one piece of the continuum, but really try to expose, especially at the BSW level, students to the spectrum of what it's like to work with older adults, from healthy aging to the need for skilled care. Like Mar said at the beginning, I did work at CSWE for a while, and when I was there, I was working on one of the Harvard initiatives, I was working primarily on the faculty development initiative, where we provided various syllabi and course exercises and assignments to faculty that they could use to infuse into their already existing courses to teach about aging and older adults and their families. So the Harvard Foundation funded, as well as the faculty development, they funded various initiatives in geriatric social work. And the other one I want to mention here that I wasn't directly involved in, but really a strong program, was the Harvard Foundation Become Partnership Program, which started in 1999 and focused on the advanced field curriculum for master's degree students. So it evolved into the Harvard Partnership Program for Aging Education, but even through its evolution, it really maintained as a program for MSW students. So like I was saying before, I think one great way to expose students to the healthy aging all the way to skilled care is do something like a rotation model while they're in the field. So for BSW students as well as MSW students. So partnership model was an MSW multi-site training program. So many MSW programs across this country still implement this rotation model. So students rotate among various agencies that serve older adults. Students have a different field supervisor at each setting. They become better prepared to confront the challenges of a complex service system of older adults. And so my question always is, can we, or why can't we, implement a model like this for BSW students? Certainly knowing that logistically there are some hurdles and challenges to overcome, but I do think that it is possible to do, and I think it might be worth trying. And I'm sure there's some BSW programs across the country that have tried this model. So a couple years back, Bob Connolly, myself, and a few others developed and implemented a survey which we sent out on the PD listserv, and that's a listserv of undergraduate social work educators, so the program directors as well as other educators. And we were very interested in knowing what programs across the country do relative to field placements in gerontology, specifically whether or not they had students going out into nursing homes. So you can see from this chart, we had 32 programs respond to us, and then you can see some of the demographics there. I'll let you take a look at that. So some of the results from this nursing home, so 97% of those 32 who responded to us said that they exposed students to careers and services for nursing homes and CCRC, so continuing care, retirement communities, and adult day health care centers. 59% sponsor initiatives that bring attention to nursing home or aging in place. 20% said that they partner with schools of nursing or medicine to engage students in interprofessional activities. So, for example, where I am here at Mason, we are in a college with the school of nursing, so we try to do some partnerships as well. Some more results. So 38% report high or moderate level of knowledge of the MDS. 38% think the new psychosocial requirements of the MDS 3.0 will affect the quality of psychosocial services. 31% report that they teach the NASW standards for social work services and long-term care facilities, either at a moderate level or even more than that. So some examples of practices, learning approaches for social work students, for undergraduate students in nursing home, and this is always a fun part of a survey, right? Because then we can see what creative things other people are doing. So some folks have students complete their 50 pre-service hours, like a junior field placement, but more informal than that, in a long-term care facility or long-term care center. They complete interviews with diverse adults for a research course. So that's infusing aging even into a research course by completing interviews with diverse older adults. Some programs have their students go to local assisted living facilities and interview older adults as part of an intro to generalist practice skills course, and then others participate in interprofessional caregiver simulation with social work, nursing, health sciences, working with other disciplines as well. Some students are required to complete a social history interview and form for a local nursing home social worker, so giving students experience in completing the forms, leading virtual dementia tours to long-term care centers, long-term care facilities for in-service training of staff, adopt a grandparent program with a nursing home, which is becoming more popular for students to do, pair student to older adult in a nursing home during their junior year, and then field placements, like we're really focusing on today, how to really increase more field placements and opportunities for students in nursing homes. Okay. Now to Bob.
All right, thanks, Cathy. I think you can see from our survey that folks do have nursing home placements, which is good. I think they really understand how, with the MDS 3.0 and with more interviewing requirements, how generalist skills at the BSW level are being more and more marketable in nursing homes. For this study, I decided to work with the NHSW Maryland Aging Committee to kind of see, could we go earlier the BSW to try and engage students. So we're working with 3 community colleges in Maryland, and it is verifying that these students are usually afraid of going into settings, think they're going to die or are all demented. Really, our society, the ageism, has really gotten to be very uncertain about this. But yet, we know if they get in the door, they will see what a vital and important career choice it is. The second thing we've found in working with these 3 community colleges is that we want to know about aging jobs and competencies. And what's interesting in that, it's very hard, like I looked in Maryland, to serve people could find jobs in nursing homes. I found that the larger ones do it all with their own kind of web-based networking. They're the paper. Students don't really know how to get there, and they really need somebody to help them away to get in there. And it's mentioned that we can't address aging fears just in the classroom, and I think Cathy said that. The thing that I think is really needed in our chapters trying to do in the 3 colleges that we're working with is can mentors. We're out and we're going to speak at the 3 colleges, and we've spoken actually to Hood, where Lynda is. Can we mentor? Can we network? Can we offer them a way to shadow? Can we connect? Because once they get in the door, they're there. I think that there's really an opportunity. And the aging agencies really need to partner. What we found is the community colleges have a lot of students who are getting their AA and would work at aging but don't know much about what's right out of school, like activity support or food service, etc. Also at the BSW level. So the silos. So how can we partner and get these students more aware? So next slide, Cathy. I'll end by indicating that with a couple of the field instructors, Laura Atkinson and others at Hood, I've seen that a BSW can be a fabulous instructor to BSW students. And I look to find that in the CSWE that there is the field instructor could either be a baccalaureate or master's degree in social work from a CSWE accredited program. And kind of want to put this out there because many nursing homes, over 16,000, all of them have MSW to supervise, and you need manpower across the community. And I think that we need to look at that as we move forward. So now I'll turn it over to Lynda.
So now we're going to move over to from Lynda. I want to say a few words about Lynda before she actually starts. A clinical social worker with a lot of experience, over 3 decades of experience in clinical social work, and she's currently a professor at Hood College where she teaches practice and directs the program. She's known among her peers for her research in gatekeeping, and she's had articles in the Journal of Social Work Education, Social Work Education, Journal of Gerontological Social Work, and also a 2015 chapter in Foundations for Excellence Social Work Field Directors. And so with that, let's hear a little bit more about Hood College from Lynda herself.
Okay. Hello, I'm Lynda Sowbel. I'm from Hood College, which is a small baccalaureate college in Frederick, Maryland, which is about an hour from Washington, D.C., and about an hour from Baltimore. We have an undergraduate program with 3 full-time faculty and about 50 to 60 majors right now. This year, half of our placements are in gerontology. I'd mentioned that I've been teaching Hood for 15 years, and also that we're one of the very few, I think, BSW recipients of one of the Johnny Harford founding grants that Cathy Tompkins was involved in and mentioned earlier. We had the opportunity to infuse aging throughout our curriculum back in 2002 and 2003. Some of the kinds of placements, which many of you probably know, are continuing care facilities, nursing and rehabilitation centers. We've used the Department of Aging and the Alzheimer's Association. We've used adult daycare programs and social services in several different counties. One has a senior care program, which involves a lot of home visiting, and the other has students working in adult protective services. What I was just tell you some objectives for today, that is that I want to describe the plan change process in the long-term care settings and to do generally what makes a strong field placement, for students, and then specifically what makes a strong field placement in a long-term nursing setting. And lastly, to identify some of the characteristics that I think students need to be in these long-term care settings, and that is helpful to field instructors, certain characteristics in working with students. I will also give a case example at the end, a vignette of a student and field instructor that had a positive experience this year. And we talk about planned change, and we talk about the 5 phases in nursing home setting, intaking, as I like to say. The students have many possibilities, many patients that they can work with, and we want them as generalist social workers to have as much contact, individual contact, group contact, family contact, and observations of their contact, as kind of like the simulations that Cathy Tompkins was talking about. So those contact and that observation by the field instructor, other social workers, might include their looking at the process recordings for the students, not just having the students shadow them, but actually shadowing the student and observing the student in their roles with patients and their families. This should come to the supervision with an agenda of what questions they have in terms of their work with the clients, and role plays in supervision to prepare for meeting with their residents. So we like placements that are willing to give students a wide berth in terms of access to many different clients. So there's a lot of data to collect in long-term care facilities, and so students get a lot of opportunity to assess and collect cognitive and mood data, including BIMs and many status exams and the initial plan of care, the DNRs, the social histories, and most perhaps there's lots of different documentation in a nursing home. Instruct also assess their students using lots of different documentation from the agency, their process recordings, their learning contract, etc. So there's plenty of documentation and assessing and data collection that takes place in the nursing home. As we require that students meet weekly with at least 3 to 5 patients to plan and contract for what's needed and what might manifest itself in the care plans. It means there's a plan for competencies through tasks and strategies of the learning contract. Our students intervene with patients, families, groups, care teams, and community agencies. And the instructor tends to intervene through the supervision and play, the observations, the various teaching tools that they use, and the observation of the documentation and the process recordings. When students are ending their placements, they have the opportunity to terminate, and but they have the opportunity to date with training for rehab clients, rehab residents, and the instructor, of course, terminates with the student and evaluates their work throughout the year through supervision and evaluations. Okay. What is a strong field placement? First, we have to ask, what is a strong field placement generally? And a strong field placement generally is a step is having students. It's a student-friendly setting, not just from the social worker, but from departments, and a place that has a social worker willing to provide weekly supervision, and an instructor who's able to distinguish the trajectory of a new student in field from specific problem students. And so we like to have some experience in the field instructor, like a field instructor who's very communicative and lets us know early and frequently if there are issues or if there are things they need some help in trying to figure out how to intervene with, and is willing to come to our trainings, which we make mandatory, and wants to consult with other field instructors there, wants to consult with the liaison and the field director. And these are kind of minimum characteristics that we look for in a good placement if you have the luxury of being active, which I do since it's a small program. So what does a good nursing home placement look like? It looks a lot like a good field placement generally, but we like more than one social worker. So if social worker is out or something happens, and there sometimes is a lot of turnover in long-term care facilities, that are other social workers there. An environment that's friendly to students, including the nursing department, the activities department, as well as the social workers, and an environment that is not so understaffed or overly harried that there's a negative morale there. There was a placement had at one point where there were two social workers who do not speak to one another, and so when one was away, the other wouldn't cover student, in fact, wouldn't answer her questions or work with her because she didn't want to have to deal with the other social worker at all. And that was not what we consider to be the ideal kind of environment for the student. I had another nursing home that I had called about having a student there, and when the field instructor reacted that she really didn't think she would have an hour a week to give to a student for supervision, then that kind of took care of that as a possible placement. But I have to say, and I did say to her, would you really want my student working there without any supervision at all, just to come in and just be working in your facility without any supervision? And that just struck me as so, I was just so incredulous that she just thought that was too high an expectation. And that was what I said to her was a minimum requirement of at least an hour a week supervision with the student. So, with in mind what makes a good field placement, we have to say, what do we need students to, what students need in these placements? And maybe these things are somewhat relevant to all field placements, but I've noted that they're particularly relevant for students in long-term care settings, and I love what I'm including today came from my field instructors and students who are in these placements. So students need to be flexible, obviously, and pick up things quickly because it's a very busy place. For some facilities are very busy with a big volume of work expected to be done. They need to have active listening skills. They need to be brave about trying new things, independent and able to multitask, which many of our students are. They can't really be totally passive or timid. I mean, they can be nervous about being there in the beginning, but they've really got to be people who will be able to talk to residents and jump in and take part in activities. One of the students who was in this long-term care, the continuing care facility, what she thought was the number one thing that she needed, and she said patience. And field instructors added the fact that you work in the residents' homes means they always have access to you. You won't be seeing the clients at some set time in an office like you might in some settings, and the residents and their families are there at all hours. So in facilities, especially the elite continuing care facilities, which may cost a lot, there's often the expectation that they will catch you at their convenience, and that can make even most experienced social worker feel frazzled at times. So you need a student who's going to be able to that and to understand patient vulnerabilities, to be willing to learn, ideally take in a lot of information in a short time, into that information, work with many different disciplines, and you need to be able to appreciate what they bring to the team, as well as to be able to advocate for social work values in the team process. Nurses to dominate the long-term care facilities, so social workers really need to develop a voice on the team. Sometimes find, one of my field instructors said, sometimes you find you're the only one really thinking what it must be like from the resident's perspective, or giving voice to the perspective that the resident has voiced to you. Finally, we want the student to be able to deal with loss, which is a big thing. Surely everybody has a little bit of difficulty with that. but the students are dealing with physical, feeling, medical issues, and of course, death and dying. Have to be great at dealing with that when they get there, but they have to be capable of learning how to deal with it when they're supported through it. And where maturity and good supervision comes in. If loss or death is new to them, one of my field instructors said, they really need not to freak out about it. And her students said, you're probably most uncomfortable dealing with death, but you can't be led by fear. Do you want to say that Dr. Ernst and I had an article some year when we were working on the Harvard grant and the Geriatric Initiative grant, and we had 2 years of students doing the kinds of assignments that Cathy was mentioning earlier, proceedings and psychosocial assessments, and a final critique themselves, having several different interviews with people over 65, and we did a content analysis of their assignments to see what we thought were the prevailing themes. And one of the things that came out of that article was that no matter how old the student was and no matter what their personal experiences had been with death and dying, they all had the most discomfort around loss and particularly death and dying. And so we have created much more conversation about it, much more discussion, but many more role plays, specifically the practice classes, but other classes too, as a way of, and I have to say that I have seen quite an improvement in students' ability to handle that, and it does come up quite a bit. Same with loss seems to be a major issue so if you have a student who you know has had a recent loss and is going to have great difficulty with that, you really want to think about how they'll do in a long-term care facility. So what do instructors want? So the instructor that I'm going to talk about today, Liz has given me permission to share information with you. She says that maturity is the number one thing that she believes all students need, that residents are going to be 50, 60, or 70 years older than the student. So there's no room for a lot of immaturity. It's certainly okay to be younger, but there needs to be a level of comfort with older people and a sense of being comfortable in your own skin that maturity brings. The dean of that instructor said that because they were so much older, you need to be able to slow down and appreciate that they want to teach you things. So be able to show appreciation and understanding and take those things in. Said that being with older adults gives hope about her own future when they talk positively about their marriages and families and so forth. Instructors said they wanted students to be familiar with or comfortable with some kind of interviewing skills, ethical skills, and some knowledge of Medicare medical assistance. And while I can say that all of my students are exposed to those in some degree before they go into the field, actually some are better than others, it's really in the placements where those skills and knowledge get honed. And I really can't say, we talk a lot about ethics, but we do a lot the specific ethics work when they're seniors in the field, get some interviewing practice beforehand, and they get exposure to Medicare medical assistance in their policy classes, but I really couldn't say how competent they would be in the area of knowledge when they're going into the placement. But do vary. They're on a continuum, as you all know. So what need? Student-friendly environment, weekly supervision. Students with little experience need an instructor willing to put in time, especially in the beginning when the student is first there and feeling very unsure of themselves. Instructors need students to move towards independence, especially by the second semester. They need them to have lots of patient contact and lots of comfort doing documentation. Seems overconfident, the instructor has to be comfortable giving them feedback. Change is constant in this kind of setting, and that's something you have to keep in mind when you're selecting students for these settings. They really are the place where the theory and the knowledge get tested out, and the student gets to practice what they've learned ahead of time in their other fields. So lastly, I just want to tell you about and we had this year with this is people I have on the screen are not the actual student and field instructor, but we just call her Instructor A and Student B. And one was that the instructor it felt that the student had a lot of bravado and overconfidence, didn't dress appropriately, and really presented herself as knowing whatever she needed to, even before she started at the practicum, when she interviewed for the practicum. And the instructor did let the liaison and myself, the field director, know her concerns about the student appropriateness in multidisciplinary meetings, her class, which she felt was more appropriate for going to a cocktail party or going out dancing than really coming into the professional setting. But initially, her overconfidence. And was telling both the liaison and the field director that she loved her placement and she thought her instructor was wonderful. So when the liaison for the first visit, she spoke to the instructor first alone to make sure that she understood where the particular issues were. And then they met together with the student. And I have to say that the liaison did an amazing job of just helping the student to talk and helping the field instructor to express her concerns and challenge the student in a gentle way about the way she was presenting in the meetings. And some of the staff had apparently commented to the field instructor. The student ended up crying in the field meeting, which is not something that often happens, but she said she had no idea really what she was doing. She felt totally awkward with herself, and she had grown up with the idea that you never know, you're unsure of things. And was able right then in the meeting to sort of acknowledge that what looked like bravado was really her insecurity, and those were the two that she had in her repertoire, to be very overconfident and show this bravado, or to be very insecure. And she was, but really amazing about this was both the process that happened from that liaison meeting on, between the field instructor and the student, but also what happened in the seminar, because the student came into the seminar and talked openly with other peers about what happened in the meeting, that she had cried, that she had been overconfident, that she had been presenting herself in a certain way, how the liaison had helped them to talk together and how they had kind of moved forward. And I'm happy that we didn't really even need a corrective plan at midterm, because the student made such progress after that point of the first visit, and about 7 weeks in, I'd say, and made a lot of progress throughout. But I think it was a great model for the students, the other students who might think about having a little difficulty here and there, but would be much more reticent to talk about things they're aware of about themselves, and especially because my seminar has been a little bit clearer lately. So it's harder to talk about self-awareness kind of issues. So it was a great model for the other students. I'll just say that this is not the end, because what we've done today is just give you a small taste of what one needs to consider in placing students in long-term care field placements, and a lot more to find out, and a lot of research needed to experts at this, but we wanted to start the dialogue. Okay.
Much. That was wonderful. And I'm going to ask Cathy and Bob to also unmute themselves and be ready for some questions. So if anybody would like to put a question in the Q&A box, we'd love to have your questions or your comments. I have received a couple comments about people wanting the handout, and we do have a handout of both PowerPoints on the University of Iowa School of Social Work website under National Nursing Home Social Work Resource. Work Network, and so where those PowerPoints are saved as 6 slides per page. Any questions or comments? And while people are forming their questions or comments, Bob and Cathy, if you have anything you have to say. If you please, all right, so there's something in the Q&A. Oh, we have a student on as part of this. That's wonderful.
Good.
Thank you. Thanks for self-identifying. We do have a question. How do you manage the student intern's over-eagerness to start working on his or her own cases and patients?
The student is asking what you do to try to help the student be patient in getting her own caseload?
Actually, those are two separate comments. One comment was from a student just saying that she was here, and then a separate comment was about how do you manage the student's over-eagerness. Yeah.
Well, I'll just say that I encourage my field instructors to get my students working with students relatively quickly. They may not have a whole caseload, but they start talking with people and going in and doing assessments and so forth very, very early on. And I might not mention that it's because there's so much patient contact and so much documentation and such in some ways a protected setting for the student to really explore and experiment that gerontology placements are really ideal from my point of view for gerontology kinds of placements, for generalist placements, and that's why I've had so many this year.
You very high percentage of your students going into long-term care settings, which is really beating that for the country because we so desperately need more social work students prepared to work in long-term care settings and work with older adults in general. So hats off to you for doing
Thank you. We had the Harvard grant back in 2002, 2003. We made the commitment to expand our field placements to at least be a third of our placements. And that was what we did at the time, and we kept that up for a while. And then just really this year was the highest I've ever had. Next year's probably going to be not quite so high, but we always have over a third. Yeah.
That's amazing. That's really great.
Yeah.
There did come a question in the chat box. I'm going to go ahead and read it. Many students are fearful of death because of lack of experience or too much experience, but they might really be fine with it in the future. How do you address these concerns?
Right.
Sure.
Yeah. I could just say that in the NR, which goes with the practicum, we do a lot of talking. And when somebody has lost one of their patients, they come in and they say that it was difficult. Even if they don't say much more than that, they usually come in and say, I've had a really rough day. I lost my patient. Or they may say, I didn't really work with the person that much, but I'm having a lot of feelings about it. And we usually make that a priority for the seminar that night if somebody does say that, or if they've come to me privately to say, I'll say, can we talk about it in class tonight? But we'll have assignments, as I said, in Methods 1 before they get into the field, related to role plays and so forth, related to death and dying, not just of elderly people, but death and dying generally.
Right. I think I absolutely agree with you, Lynda, that handling it in the class, the issue and the content around death and dying in the classroom is important. And what I try to do is I really try to separate out like curriculum and assignments relative to death and dying, and specifically working with older adults, and just talk about death and dying, across the lifespan, because times, again, when we have those myths and stereotypes that students often have about older adults, they come in thinking that how can they make a difference since all these older people are going to die soon anyway, right? So
Right.
So the reality, I certainly think, absolutely, we need to give students the skills to cope with, death bereavement issues when sent to the long-term care facility. Also, make sure that it's more than that, right? It's more than just teaching about death and dying.
And I think that sometimes students need to talk about their own feelings about life and death and what they think about it, or that they want to avoid it or whatever, so that we can kind of get to the next step.
Right. It might also be helpful for the students to be able to talk through how to manage discussing death in that setting. So in some nursing homes, it's very public when somebody dies. Maybe their obituary is put on the bulletin board or something like that. In other nursing homes, they don't necessarily even tell the roommate that the person died. The roommate may have been discharged to the hospital and then just never came back, or might have been discharged to another nursing home and that resident's roommate just never knew. So you're trying to find out how happy are the residents or satisfied are the residents with the way that news of death is handled, and what kind of rituals are available right there on site for the residents and for the staff, because it is a setting that does have a lot of loss.
Right.
That's good.
This is Bob. I haven't worked in nursing homes, but I worked 14 years in cancer centers and intensive care units and that kind of thing. I think a field instructor is an important to that student to really prepare that people get sick, chronic illness, death, and dying, and to talk about it, and then if it happens, to have that supportive relationship to process through, because often people feel there's something you should say or there's a right way to deal with it. As was alluded to, it's really each religious tradition, each kind of culture might have different approach, and the approach of a social worker is to be a listener and to be present on the road and to let people talk. I think for a student, that may be the first experience, or it may remind them of other deaths in their family, be it grandparents or parents or siblings. It's important that they have a way to do that, and I'm glad it happens at the school and the seminars, but it also, I think, is that supervision of how you learn from this and how you understand a little bit of what the psychodynamics are, and that we're human, and that our relationship is very important.
And speaking of that, Bob, this is Lynda. I think it's important to do training with instructors around this too, because both with instructors and classroom instructors, because we have to feel comfortable about this ourselves in order to help the students with it. And the other day, I had students doing a role play about somebody who died, who lost a friend to breast cancer, but it wasn't an elderly role play. So, and the students asked a lot of questions before they ever did the role play about being uncomfortable about what to say and what was the right thing, and they got to learn somewhat from other students wonderful ideas and some wonderful about what they must say, so that next year when they're actually in the field, they're hopefully, they'll think about this. I do think we want to give as many opportunities as possible in the classroom, but then, of course, Bob's right, we really make sure that all the field instructors feel comfortable dealing with it too, because it's not a given that the field instructors or the academics are going to feel comfortable with it.
Right.
Mm-hmm. Any comments from any of the people attending today? I'll a couple things too. We had somebody who said that she had one semester at a VA nursing home on a secure unit, and then a second semester visiting multiple nursing homes and acting as a liaison between the VA and the community. And 4 years later, she's still working in nursing homes. So wonderful.
Yeah.
The supervisor makes all the difference between a positive and a negative experience, she says. So that's great to hear.
I just wonder from our listeners, any caseload is a barrier to be able to take on a student, and sometimes the setting has a lot of transition and in which you can't do it. But is receptivity of the schools of social work that you work with to have students come to nursing homes? Because NHSW, it's about 5% with gerontology, and in bachelor's, you have a gold standard of hood with 50%. But I wonder if you all have relationship with schools in your area or teaching in schools, you might have some experiences to handling or some of the challenges.
People are thinking about that and typing it in. I have something for Lynda and Cathy to also. Some nursing homes that I have conducted research in and with are dealing with very tight space issues. And so actually even giving the social work student his or her own desk may not be possible. What do you have to say about the kind of space that's allotted to social work students during their practicum, physical space?
Well, I think that's an issue in a lot of agencies across the board, but certainly have seen it in nursing homes as well. And we try not to limit the opportunity because of space, if at all possible. So, I'm just thinking of a program that's become very popular across the country and many nursing homes is the Music and Memory program. So with a program like that, if a student with a program is loading like residents' favorite music on an iPod and having them listening to it at times during the day that may be most difficult for them, whether it's a meal time or sundowning time, whatever it may be. And so I've seen students, just hanging out in a common area, sitting with the residents, doing different interventions. But the Music and Memory one is one that's coming to mind. Right now, the students can have the job. Many of our students have much better technology skills than I do, anyway. So loading music on an iPod is nothing to them. Where for me, I get all stressed out and I have to think a lot about it. So that's one role they could have is, working with the residents if they're able to, or working with family members or staff to put favorite music, this personal piece is important, on the iPod, and then they can sit in a common area. For many interactions that we do in nursing homes, sometimes we can kind of get around the limited space issue. I try to, go out with liaisons and assess situation. I know our field director here does too. Sometimes it becomes a barrier, but we try not to let the space issue limit the opportunity for students, if possible.
Okay. Experience been a space in nursing homes?
Well, a lot of my nursing homes have had the space for students, and sometimes they fit the students into the office with a social worker. I have had the experience that they I occasionally had two students at a nursing home, but they came on different days because there wasn't space for them to be on the same days. So generally, I agree with Cathy that it's an issue not just in gerontology placements. And my ideal is that if a social worker in this place needs a computer or a phone or a place to sit, then the students do too. But like Cathy, if I had a good opportunity and they just didn't have the space, I would probably work with the student to come up with an alternative plan for what they're, and they spend a lot of time with the residents or in team meetings and so forth, that they must somewhere to right. kind of locate themselves. So, right. Doesn't have their own office or the social worker's right. office, but someplace.
Okay. Thank you. I did have another comment come in. The University of Washington, where I graduated from and where I'll be taking a first student in a couple of months, suggests nursing homes a lot for practicum placements, not only for students interested in gerontology, but also for students interested in mental health and health.
Great.
That was a comment. So And then somebody else said, I'm currently a field instructor for the Internships in Aging program for the School of Social Welfare at University of Albany. My current intern and others that I've had their rotation in nursing home settings. It has been wonderful.
Yeah, great.
Great. I should mention now that we have we have 30 webinar recordings, all related to nursing home social work, that we produced over the last couple of years on dealing with families, dealing with conflicts, oral health in social workers, urinary incontinence in social workers, guardianship, transitions, all sorts of topics that have been developed and are free for you to use in the classroom setting or to help prepare students to be functioning in the nursing home. And Bob, I think I heard you begin to say something.
That's me.
Oh, sorry. Anybody else? All right. Well, thank everybody for joining us, and the recording of today's session will be posted on the University of Iowa's website in the next 48 hours. Thanks, everybody, and thanks for all the hard work you're doing with students and with nursing homes. Bye-bye.
Bye-bye. Thank you.
Bye.
Bye-bye. Gabby. Bob.
Bye.
Bye.